Today's tutorial is on anxiety and herbs or methods to control it. Whether it's anxiety or panic attack, sometimes one of the biggest challenges for my patients who suffer either of the two is driving at rush hour in the morning. I think rush hour in the morning is worse than rush hour at night. And this is not a safe thing to do, meaning this here, filming during rush hour, because it distracts, just like texting and phone messages. So please don't try this at home. But it's for a point. And let's just talk about the definition of anxiety or panic attack. Anxiety is a unusual response to a usual activity. So it can be in the form of having an unusual response, a hypersensitive response to pains, like chest pain, or an irritated child that's crying. Those kind of abnormal responses for normal human circumstance result in a supernormal response, like a fight or flight response that is called on at the wrong time. If I have a patient that's trying to get some sleep but can't get to sleep because they're worried they're going to have a heart attack or somebody's going to break into the house when there's no cause for alarm or when there is no true chest pain, then the stress response will be initiated to hopefully get that patient out of danger. But when the stress response is initiated for normal activities of protecting you from a predator or fighting an infection, it's always great. High blood pressure, fast heart rate, increased temperature, fast breathing, that's all helpful for escaping danger or fighting infection. But when you call on that stress response and it's initiated in the middle of a speech, in times of study, at times when you're trying to get to sleep, then it certainly is not helpful, and it's actually harmful because it interrupts the normal activities of love, normal activities for relaxation, normal activities of digestion, and a whole world or a whole constellation of symptoms and problems will come up. So I had to pull off the road because it was getting too stressful to drive and film at the same time. And I pulled into this park district in Illinois. It also serves as an example of what you should do. You certainly, if you have anxiety or if you have any problems associated with panic attack, until the treatment starts to work, whether it's mind-body medicine, behavioral health, or herbals, supplements, or prescriptions, in the time period that you're still suffering from the disease, you really try to limit the exposure to stress. No one can ever take away all stress, but sometimes if you avoid rush hour, like I was just in, if you expose yourself to more relaxing surroundings, an environment like this, it might help with decreasing your reaction to that stress. That's called, again, the stress response. Herb Benson came up with the relaxation response. That's the opposite. And as I've spoken in previous tutorials, the relaxation response is not a normal thing that we practice, but the bottom line is that it has to be practiced. Just like sports have to be practiced to be better at sports, relaxation response has to be practiced so that you can control your reactions to common stressors. So, back to our tutorial with regards to anxiety and stressors. Integrative medicine is fantastic because it wisely combines Western medicine and alternative medicine. It's intelligent combination of the two. So if a patient comes in with extreme anxiety, upset stomach issues, can't sleep, chest pain, body aches, excessive worry, then that needs prescription medicines. And Xanax is fantastic for cooling down symptoms. I think that by itself, without any behavioral health intervention, diet change, relaxation or relaxation response development, it is kind of dangerous and it's addictive because it cools down the anxious response so fast and so clean that the person that's anxious will always want it around. So it sets up, if it's the only treatment of choice, it sets up for, I think, a behaviorally addictive quality. So in the case of Xanax and other prescription medicines, I think it's still wise, if it's that severe, to be on the medicines, but also to have a plan to get off of them too. And that usually is by changing nutrition, exercising, developing the relaxation response, and seeking out behavioral health with a counselor or psychologist. So that out of the way, I will talk to you about my my usual go-tos. First, if the anxiety is not too bad and just starting up, my first choices are usually omega-3 fish oil, usually about 1,000 milligrams twice a day. And then magnesium, making sure that the patient doesn't have any problems with kidney disease. It's important because too much magnesium with kidney disease can cause an accumulation and toxicity. So magnesium is excellent as a supplement for taking care of palpitations, helping with sleep, taking care of constipation, muscle cramps. So magnesium at about 200 milligrams twice a day, in addition to that omega-3 fish oil, as I just suggested. If a person is a vegetarian, doesn't like fish, then you can certainly go with vegetarian formulas for omega-3. Sometimes the omega-3 can be pushed to 2,000 twice a day, but it causes side effects, so you have to be careful. Excessive burping of the fishy odor or problems with indigestion can be a result of high dose, so I usually tell my patients to freeze their omega-3 capsules. That's mostly the fish. The vegetarian source or the krill or the flaxseed usually doesn't cause side effects like that. So we have omega-3 fish oil. We have magnesium, both of them twice a day. I think that's a good basis. Sometimes also supplementing with vitamin D, but I'll leave that in the other tutorial which I have. Check out the vitamin D tutorial I put up earlier. Moving on to more specifically calming supplements. Valerian with lemon balm is my usual go-to. It's hard to find the combination together, but you should call your herbal shop, your Whole Foods market, or your Fruitful Yields and check out or ask or inquire if they have that combination. Valerian by itself is a root, has a distinct odor. Some people don't like it. I do think that freezing or refrigerating that capsule might help, but the odor is hard to get away from. Again, it's usually, the dose varies, but the studies were from 160 to 600 milligrams per day. So usually I tell my patients to divide it up into about 200 milligrams 3 times a day. Now that has to be with a combination of lemon balm. Lemon balm can be found about the same. I'll make it 300 milligrams per day. Again, divided into 3. So hopefully you can find a nice combination. Doing that for about 21 to 30 days straight will hopefully provide some cooling down of their stress response, the anxiousness, and the side effects are very limited. In addition, there's also, for an acute outbreak or episodes of recurrent panic attack while waiting for the anxiety to take care of itself or to change, the use of kava kava is nice. The kava kava is a Polynesian herb. It works great for cooling down the mind. The only problem is kava kava can build up and cause problems in some studies with liver toxicity. So you have to be careful. I usually will say try to limit it to twice a day dosing, to 3 times a day dosing at the max, but nothing over 4 weeks. Always need a break. So try to concentrate the use during times of stress, like tax time, holidays. If there's a tragedy or a occurrence in the family, then use it during those 4 weeks, and then give yourself a holiday off the kava kava. Great medicine, though. The last 2 will be extracts or tinctures. Passion flower is a great go-to. I like Gaia brand. I think you can find it at a lot of places. Passion flower extract, it's about 20 to 30 drops 4 times a day as necessary. Really works to calm down. I'll use it before giving presentations. I tell my patients that have panic, especially at night, to use it in addition to the valerian with lemon balm or the other things I might be giving them for sleep. Helps to, again, calm the mind. It's short lasting. That in addition to skullcap. Skullcap is great, but it's hard to find it in capsule or tablet form, so usually it's just a matter of either passion flower or skullcap, and the studies on skullcap has an anxiolytic to calm down anxiety are great. Actually, it was used in earlier days for seizure, found to just relax the brain. If you can find it in capsule form or in solid form, that'd be great. 3 times a day, divided up over the course of a day. As usual with any herbs, you have to make sure you're getting good quality, so you have to trust the brand. Do your own research, call the 800 numbers that are on the back of your bottles, and inquire about how pure the product is, what they do for quality, and who their buyers are. So, in a nutshell, the treatment of anxiety is multifactorial, but taking care of some deficiencies in your nutrition would be the first step. Getting a behavioral health professional to assist with finding ways to calm down that stress response and develop the relaxation response, also very important. And seeking out a professional that's trained in integrative medicine so they can help combine the two. Has one last suggestion. I do medical acupuncture, and at UCLA we're taught application of several acupuncture needles, supposedly the Valium points. So several different points that we use to relax. So if you are still having problems with all the previous suggestions, sometimes seeking out a traditional Chinese medicine doctor or a medical acupuncturist trained from UCLA would be another way to utilize alternative medicine in calming down that response until you get a better hold of controlling the stress response.